one of the great exercises that I use for tons of different patients for weight bearing through the legs, for trunk stability, is starting to work in bridging. Okay, so we'll show a lot of the different things that we do in bridging, and I'll just go through several different ones as far as resisted bridging and different things that you can do with it in this position. Okay, so first thing you want to think about is how people just do a straight bridge. Okay, because a lot of times the way that people bridge is not the way that I want them to. All right, so if you just think about bridging right now, if you're just a patient, if someone's taught you somewhere along the road how to bridge. Okay, I want you to go ahead and bridge up. Okay, and let it go back down. Okay, so a couple things that were good about that, and then a couple things I want to change. You did have some elongation of your legs, which is key. A lot of times what people will do when they bridge is they will just think, they'll either do rolling their pelvis and doing like a posterior pelvic tilt when they do it, which I certainly don't want to do because I don't want to train them in a posterior pelvic tilt. Or they'll come up, kind of like you did, and come up and keep coming, and coming up into some extension. Okay, and there's a lot of compression that goes into the lumbar spine when you do that. Okay, let it come back down. So the way that I always teach bridging for anyone, especially if I'm going to do any resistance, what we call bridging with distraction or bridging with elongation. Okay, so the way that I'll facilitate this first is to come around here, come onto your distal aspect of your thighs, and as you bridge up, I want you to think like your knees are just coming straight out this way. Okay, so, and I'm just going to come on here and give some traction and guide that. So we're coming up just to here, and then back down. So can you see how there's a lot less compression in the trunk when she bridges up here? So she's getting her knees coming out really over her ankle joint, even a little bit over her midfoot as she comes back down, as opposed to just come straight up. Just coming straight up and going into trunk extension. Okay, so especially if I'm going to do resistance, I don't want to resist in a compressed lumbar segment. Okay, so right there I can do facilitated bridging just by coming on here and have you come on up and just let her really feel that this is the direction that we're coming, and go back down. Okay, go head up again. So I'm facilitating that. Let it go back down. Now I can even resist that a little bit. And if I'm going to start resisting bridging, a lot of times I'll resist from straight on now, but still with my hands in that lumbrical grip like we did before. Now as you bridge up, I want you to push your knees out towards me. So she really gets that idea of getting some length in her trunk as she's coming up and down. Okay, so bridge up again. Okay, so now she should have a good idea of what I mean when I say I want you to bridge up. Okay, so once she bridges up, now I want you to come up. I can resist her in a lot of different places right here. Okay, probably the easiest is right at her pelvis. So if I bring this up a little bit, I'm going to be slightly off at an angle here. I'm going to be slightly on the lateral aspect of her ASIS on the side closest to me, medial to her ASIS on the side away. Okay, and all I'm going to do is start to resist her, so I want you to just keep this position here and hold it. Okay, and I'm just building resistance here. So first I can just do stabilization, and she's definitely working to keep this position. Okay, I can go two hands. If she's got one side that's really lagging behind, let's say she's not doing it real well with this side, I might just come on here, just on that side, and see can she hold that position. Okay, or let's just build it, and she holds it here. Okay, I can come on to the anterior aspect of one, keep it here, and I can do some resistance to rotation, just keep it here, don't let me move you as I try to twist her. But again, she's keeping that same position, just like we were doing with the other positions. Keep it here. I can come around, resist her legs, hold it. Hold it here. So all different types of resistance you can do in bridge. Also go ahead and bring your arms up, just like we did before. I can come to a leg, have her resist here, resist at the arms, doing all different types of stabilization to be able to hold a bridge position. Okay, let it relax for a second. So we'll do that one first, but I'm going to show you several different things that we'll do with it. Now I'm going to do just resisted bridging. Okay, so to do resisted bridging, if I'm doing straight resistance or straight bridging, she's going to be coming up straight, but I'm still going to be at a little bit of an angle. So if I'm resisting from this side, the same position that I was just in, so slightly lateral to her ASIS on this side, slightly medial on this side, is go ahead and bridge up, and I'm just resisting against her, and hold it. Okay, so she's doing an isometric hold here. Now let's work eccentrically. Let's let it slowly come back down. Good, and bridge back up. And I'm resisting her. She's going concentric. Let's hold it. And slowly down. So I can do just straight resistance to bridging. Okay, come back up. Okay, now what we're going to do is some diagonal bridging. So she's up here. Now, as I lower you down, I'm going to push you slightly away from me. So let me bring you down that way. Okay, let it relax. Stay down there. So now, if I'm going to do diagonal bridging, because we know when we walk and we wave air through our legs, it's not straight plane. We know we've got some diagonal motion of our trunk. So diagonal bridging is a great way to start working on that. What I will do is resist her the exact same way, but now instead of coming straight up, she's going to be coming diagonally up towards me. Okay? What I don't want you to do is let one side of your pelvis, especially this one, lag behind. Okay? So if my hands are on your pelvis when you come up, I want you to come up and level. Okay? So I want you to bridge up towards me. Keep coming, keep coming, keep coming. Good, and then slowly down. And I'm just resisting her, but also guiding that diagonal bridge. Okay? And come back up. A lot of times you'll see what she's starting to do right now, and this side's starting to fade. Come on up. Good, and let it come down. Good, and come back up. Good, and back down. So, like with the other resistances that we were doing, if I wanted to do the opposite diagonal, I've got to come around to the other side. I can't switch and resist her as she's going away from me. Okay, so what we'll do, let's just straighten you out first, is we'll look at just straight bridging and how she bridges. We'll look at facilitating some elongation with bridging, so coming up here. Okay, let it go back down. We can do resistance at her knees as she comes up. Okay, and then once she comes up and she's able to understand that bridging with elongation, then we can start to build just some resistance. So holding from her, so keep it up there, holding from her pelvis, resisting either rotations, resisting legs, resisting arms, whatever you want that we've done so far as resistance points in that bridge position. Okay, and then we can go to resisted bridging. Okay, so let's try that.